Okay, good afternoon. Thank you for joining us here today. Sorry for a little delay, technical glitch. But we have some important information to share with regards to you regarding COVID-19 update for November 24th. I want to thank Jen from Deaf Access Services for joining us here today to provide the American Sign Language. I don't really have good news, unfortunately. Yesterday was a record setter. For November 23rd, the Department of Health has confirmed 878 new cases of COVID-19. That's 4,693 total cases over the past 7 days. That's a case record over 7 days for 100,000 residents, 492. It's 121,847 total cases. The 878 new cases recorded yesterday is the highest ever recorded in a single day during the pandemic. The daily positivity rate was 11%. So I wish I had better news, but unfortunately we are going in the wrong direction, and this is the worst direction we've ever had, as we've almost surpassed 900 cases in a single day. These are new cases. These are not duplicates. These are individuals who previously did not have COVID. So that's a really bad sign. I wanted to show a couple graphs to kind of give you a better idea in a graph form of where we are. This is the COVID-19 cases per day from March 2020 to November 22nd. Does not include yesterday's. But you can see there's basically 4 spikes. We're in the 4th spike. And once this chart is updated on our COVID dashboard, it'll record the 878 cases from yesterday, and it'll show it as the highest line on this graph. So you can clearly see the increase we've been dealing with, but the big spike we've seen over the last 2 weeks. Now this is looking at the positivity report and then a 7-day rolling average of the positivity report. And you'll see the spikes on the positivity report and the 7-day rolling average. Once this is updated for November 23rd, it'll show a positivity report actually over this 10 level, but at 11 for the 1 day. And it's just, once again, another example of the rapid increase in cases and the rapid increase of positivity report in the last month. Same goes for cases over the past 7 days per 100,000 residents from March of 2021 to November 22nd. You can see the line and how it's dramatically increased, and of course this will continue to go up based on the newest cases that we've seen. All these graphs can be found on our Erie County dashboard, the COVID-19 dashboard, which is available on our webpage, erie.gov, and also through the Department of Health's webpage. So you can get all this information on our dashboard, which is pretty much bad news all around. More bad news. COVID-19 cases per zip code for the week ending of November 20th, this past Saturday. The case rates per 100,000 persons are the highest we've seen to date, highest recorded to date for a 1-week period. If these rates continue or get worse, we may not be able to control the further spread without significant other action being taken. And I want to point you to the highest numbers on this report. During the past week that ended Saturday in the town of North Collins, there were 44 cases. Doesn't sound like a whole lot, but based on its population, it's more than 1 out of every 100 residents who had a new case of COVID last week alone. Some family units I've heard, whole families have caught COVID. I talked to the supervisor, John Tobia, yesterday. He was pretty down. He knows what the numbers are. And he even said there were a couple funerals in North Collins recently from people who unfortunately perished. These are just the last week alone. This is just a 7-day period. My hometown of Lackawanna, almost 700 rate for 7 days at 100 persons. Hamburg in the Lakeview section, Grand Island, Elma, Derby. Every zip code and corresponding community you see on the screen has a case rate of 450 or greater. There's no part of Erie County that hasn't been touched by COVID in its latest incarnation with the Delta variant. But these communities here are just in really bad shape. Remember not that long ago, a few months ago, when we were worried about hitting 100 or 200 on the scale, and here we are 400, 500, 600, nearly 700. In North Collins, 1,300. We're serious when we say if these rates continue, we're getting into an uncontrolled phase that we may not be able to control and stop the further spread unless we have some serious actions taken, including shutdowns, and nobody wants to do it. Nevertheless, I have no interest in doing that. Nobody wants to go back to the days of restrictions and shutdowns, but these numbers are just bonkers, as I said. They're just ridiculous. And it is not totally surprising to see this based on what we know is the vaccine numbers in some of these communities, as well as the spread of Delta. It's bad. Hospitalizations, unfortunately, there was about a 10% increase in hospitalizations from the 21st to the 22nd, and in a 2-week period, it's increased by 62%. As of the 22nd, there were 284 COVID-19 patients. Hospitals have been able to add beds, staffed beds, but they're still at or near capacity, 90% total, 86% for ICU. Once again, on the bottom, you see a lot of deaths on that lowest bar chart. We had 3 people who died in Erie County hospitals on November 22nd. I'll talk a lot more about mortality a little bit later, but I do want to offer my deepest condolences to all who've lost a loved one from COVID-19. It's a terrible virus. It's cost over 2,000 lives in Erie County, and it's taking more people every day, including those who should not die, but are because they're not vaccinated. Just another look at the hospitalization based on the chart going back to the original day of the pandemic. We have now surpassed what we saw back in March, April, and May of 2020, and we are nearly surpassing the spike we had in the spring in March and April of 2021. Our rate of growth is actually worse now than it was back in mid to late November 2020, and we know if we get to 400 people in the hospital, which is possible based on the numbers we're seeing, we are going to be easily surpassing our hospital capability unless we shut down for elective surgeries and other things, and we really don't want to do that. Hospitalizations by age, we haven't showed this chart in a while, but it's pretty spread even. We wanted people to understand it's just not seniors. On the November 22nd, there were 6 people aged 0 to 19 in hospital, but then after that, in the age groups, it's fairly spread even, with the largest age category with the most people in the hospital on November 22nd being the 55 to 64-year-old age category with 62 people. There are actually less people in the 75 to 84-year age category than 55 to 64, or for that matter, less people than 65 to 74. Disappointing to see that there are young people hospitalized, but we know COVID in the Delta variant is very strong, and it's having a significant impact among those that are unvaccinated, especially those under the age of 60 who are unvaccinated. They are making up the vast majority of those who are in hospital but are under the age of 60, are the unvaccinated. And I want to show you this chart here, which shows you the status of hospitalized patients on November 22nd. 61% of all COVID-19 patients were not fully vaccinated. But when we talk about ICUs and airway assists, intubation, 71% are unvaccinated. And when it comes to the younger age category, it's generally those that are unvaccinated by a large margin, like 90%. When we talk about the older age categories over the age of 75 and 80, there are vaccinated people who are in the hospital. But when you're under 70, especially under 60, it's almost all unvaccinated people. They shouldn't be in the hospital, but they are because they're not vaccinated. And a good example of it is what we see right here. These are, I wanted to do it a different way so people just saw it. This is the percentage of adults 18 and older who are vaccinated in Erie County by 1 dose and complete vaccination. On the left side of the screen, you see vaccinated with 1 dose. 75.2% of Erie County adults, 18 and plus, this is the 2020 population numbers, have a dose, which means 1 out of every 4 Erie County residents, adults, is not vaccinated. 25%, 24.8%. And when we talk about full regimen, those who've completed their vaccine regimen, and this does not include boosters, this is 2 shots from Moderna and Pfizer and 1 shot for the J&J, it drops to 71.1%. So nearly 30% of adults are not protected by having been fully vaccinated. And this is what's driving our problems. is there's 1 out of 4 adults who've not received a single dose of COVID-19, and some of them are very proud that they haven't. Well, they're the ones that are causing this problem because it's really driving the numbers, especially with regards to hospitalizations. And we don't think we'd see as many new cases if we didn't have so many unvaccinated people in our community. I can talk till I'm blue in the face. I know there's certain people who will not get vaccinated, but you are really risking serious illness and death. The numbers are terrible. They're just terrible with regards to community transmission. And this number here, through yesterday, shows that 75% of Erie County adults are fully vaccinated, which have 1 dose. And 1/4 of Erie County's adults, 1 out of every 4. So when you're in a room with 40 people, 10 of them, in all likelihood, on average, will not have even received 1 dose. Think about that when you go into big gatherings and big parties. 25% of the people, if there's 100 people in the room, 25 of them probably haven't even gotten a single dose. And we're just talking about adults. Mortality data, we released this yesterday. 20 Erie County residents died between November 12th and the 18th, including we added an additional individual who was under the age of 40 for the month of November who died. This shouldn't happen. And I want to point out these 2 numbers because I think they're very important. 74%, or 3/4 of all deaths since July 1st, for persons under the age of 80 were not fully vaccinated. And while people say people are dying that are vaccinated, 64% of all fully vaccinated persons who died since July 1st were 80 or older. And it's just simple. If you're unvaccinated, your odds of dying are so much higher. And we're losing people in the prime of their life because they were not vaccinated. Once again, I offer my deepest condolences to the family and loved ones who've lost them. I know some people have lost family members and they tried to talk their family member into getting vaccinated and they wouldn't. And they know that that person probably would be alive. I mean, I don't know what else to say other than it's kind of Russian roulette out there. The Delta variant is very strong, very virulent. It's running like wildfire throughout Erie County. And I know on average that 10% of all people who get sick need some sort of hospitalization. And then 10% of those people, or about 1% of everybody who catches COVID, will die. So if we had 878 new cases just yesterday alone, there's probably 9 people in there that will die. We've had over 4,000 cases in a week, in the prior week. There's probably 40 people of those 4,000 cases that will die. And I don't know what to say other than please be safe and get vaccinated. Response, we continue to respond. Our contact tracers are working overtime. There's high level of community transmission. We talked about this. There are noted family and household clusters of COVID-19. Usually if one person catches in the family, other family members will. Thanksgiving's tomorrow, and happy Thanksgiving to all. But the Erie County Department of Health encourages people who plan to gather with friends and family to stay home and away from others if you are ill. Do not leave your house. Do not have other people come to your house if you're sick. Even if you've, first off, you're supposed to be isolated if you are in quarantine if you have COVID-19. But if you are sick, you need to isolate yourself until you at least know what you got. But you should just stay away. Stay home from others. Do not go anywhere else. Do not have anybody come to your home. I know it's Thanksgiving, and everybody wants to celebrate Thanksgiving. But Thanksgiving is a secular holiday to be thankful for what we have in this country and the bounty we have and the people that we have in our lives. And we don't want to have Thanksgiving be the day that you passed COVID-19 on to your parents, your grandparents, another loved one, and they died from it. If you're sick, stay home. COVID-19 testing is a tool to make sure you know your status before you gather. There's a lot of people I heard today that are getting tested today. wanting to know their status so they get the results by tomorrow. That's a good thing. I appreciate that. I'll be taking a COVID-19 take-home test myself tomorrow before Thanksgiving, and I want people to know that you can go. There's lots of places to get tested, and you'll get your results probably before tomorrow. If you haven't done so, think about it. It is very important to know your status. We talked about hospitals. We talked about this 2 days ago. We must prevent hospitals from being overrun with COVID-19 patients. Hospitals are currently at or near capacity. The wait times in hospital emergency departments for care can be 8 to 12 hours or more if you don't have a life-threatening issue like a gunshot, a stabbing, a heart attack. If you go there with a broken arm, you're going to be a long time before you actually can get basically a bed or truthfully get the care that you need. And we really want to avoid what happened in the South where people died treated from treatable illnesses because there were no beds. There was a story about the veteran who died from gallstones in Harris County, Texas, because there was no bed for him. And he basically writhed away in pain until he died. I mean, this is just stories that should never happen, but do, and we need to prevent that from happening here. So we have our 4-phased approach to reduce caseloads in hospital patients. Mask mandate for all indoor public locations in Erie County. We'll talk a little bit more all about this. We talked about this on Monday. Vaccine mandate phase 2, capacity restrictions phase 3, shutdowns in phase 4 if it gets so bad. If we follow the mask mandate, I don't think we'll get to the vaccine mandate. If we don't, it's coming. I can feel it just based on the numbers of hospitalizations. So please wear a mask. So here's what we got in phase 1. Mask mandate for all indoor public locations in Erie County went into effect yesterday. Masks must be worn by all patrons age 2 and older or medically able to tolerate, and all publicly facing staff. There is no ability to say a religious exemption for masks. So bars, restaurants, groceries, theaters, barbershops, gyms, fitness centers, entertainment venues, hotel, banks, and all other public places. You have to wear a mask, including the staff. I went to a place yesterday, staff was not wearing it, and I told them, you need to wear a mask. And they were like, oh, we thought it was just the people who come in. And I said, no, you need to. And they did. Thankfully, they did. And we need everyone else to follow it. We are going to reassess, of course, on December 13th, though unless the conditions require an earlier implementation. We're not at that point yet because the hospitalizations are still at about 10% available capacity. If we get to 100% capacity or worse, theoretically based on their capacity guidelines, then we would really have to reconsider whether we're moving into phase 2 before December 13th or not, but we're not there yet, and I want people to understand that. Thankfully, the hospitals were able to add a few more staff beds, and they did get a drop of some other patients. I'm hearing some of the hospitals are stopping some of the elective surgeries now, or delaying them. So if you have an elective surgery come up, call your doctor. Phase 2, vaccine mandates for bars, entertainment venues. I've just seen a few other locations that have announced that they are going to implement a vaccine mandate themselves. So I think Allen Street Hardware just announced, Mr. Goodbar did, a few others are, and they can do that. And if you do that, if they have a vaccine mandate in place, you do not have to wear a mask inside the facility. So for those that are doing it, I commend them. It is a smart thing to do, but it is their decision at this point. It is the decision of the bar owner, the restaurant owner, and if they do that, because the transmission rate is much less among individuals who are vaccinated, we think it's a much safer environment. Phase 3, capacity restrictions, in which we'd have to drop to like 50% capacity and the like. Certainly have no interest in doing that, and phase 4 shutdowns. We are seeing some terrible numbers, so we can avoid it. We can avoid it by working together. I want to thank the Seneca Gaming Group for requiring masks at each of their casinos in Western New York and Erie County, Niagara Falls, and Salamanca. It's the right thing to do. You've got people coming from all over the place going to their casinos. So thank you to Seneca Gaming for putting in a mask mandate for the staff as well as your patrons. It was the total right thing to do. And we need to come together as a community to get through this and ensure our local businesses not only survive this wave, but thrive. And we need to do that by wearing a mask. We must take united action to prevent further spread by wearing a mask. We know it is the #1 thing that stops COVID in its tracks. is to wear a mask. And if you have multiple people together with a mask, wearing masks, the chance of spread is very, very low as compared to having no masks on. So we have diagnostic testing. If you are not feeling well, you should get tested. There's lots of places to get tested. You can call Erie County at 716-858-2929, and we offer free testing to our residents. We do offer testing to others, but we do charge for that. If you have health insurance, that normally covers it, but for Erie County residents, it's free. We get PCR molecular tests available in 1 to 3 business days. They're basically running 1 day behind, so if you got a test today, you might get the results actually tomorrow, even if it's Thanksgiving. Appointments are required, 716-858-2929, so please call that for the test. We have vaccine sites. They're still open. We have a schedule at erie.gov/vax. We have dates. Actually, we have dates right now at SUNY Erie South, I think until 4 o'clock. But we also have them on the 26th, 29th, and 30th, and the Hindu Cultural Center on the 30th. Registration is suggested to move your appointment along a lot faster, and walk-ins are welcome, though. In Vax visits, you can call us, 716-858-2929, and you can get vaccinated in your home at no cost. Option for release from quarantine after day 7. Dr. Burstein talked about this. We wanted to go into it again. Quarantine may end after 7 full days following your last exposure, but you have to have had a test done in 48 hours before the end of the planned quarantine. So after 5 days following your last exposure, you get a test. If it's negative and you don't have any symptoms, you can leave quarantine. And there is more information of that on our website at erie.gov/IQ, which means isolation and quarantine. So all the rules associated with that are on our website at erie.gov/IQ. Good news. Very good news to announce is that the Shop 716 program is back, and for 2 days, Black Friday and Small Business Saturday, we are once again doing the buy a $50 Shop 716 gift card and get a bonus $50 gift card free. This can be used at over 7,000 small businesses in Erie County. It's a great deal. It helps support our local businesses, and where else are you going to get a buy one, get one free $50 gift card? So you can buy a gift card for one person, get it for another person, or get the other $50 gift card for you. You get them online, amherst.gov/shop716. This is on Friday and Saturday. If you go there right now, the bonus won't be in effect yet. So do it on Friday and Saturday, and then at many of these locations you can shop online. You can use it for services. You can use it for goods. Let's support our local businesses and do it safely. When you go shopping, wear your mask. Get your Shop 716 gift card and spend, spend, spend. Finally, happy Thanksgiving to all. I truly do wish everyone a happy Thanksgiving. This is not the Thanksgiving we probably thought it was going to be once again, just even a couple months ago. We figured we'd be in much better shape, but we're not. So it is important to all that you be safe and well, and you do it by not going to a location, another family member, a friend's house, if you are sick. If you yourself are sick and you were planning on holding Thanksgiving, don't have people at your house. Make sure it's a happy Thanksgiving by not passing on COVID-19 to someone else. It's bad out there, as we showed. The worst day ever recorded in new cases for COVID-19 in Erie County was yesterday. We don't expect it to get much better in the next few days. We implemented the mask mandate effective as yesterday. We're hoping to see some of the results of that in about a week, because the people who caught COVID and got tested and found their results out in the last 24 hours probably caught it before the mask mandate went into effect. So wear your mask. You might even want to think about wearing masks if you're joining your family members other than eating at the table. Get tested if you don't know your results already, and be safe and well, and have a very happy Thanksgiving. But no, it's not a good time out there as it pertains to COVID-19, and we want everyone to have a very joyous, happy holiday season, not be laid up inside with COVID-19 and everything else that can come with that. So with that, I'll open it up to questions and answers to the members of the media, if you can open up the lines. And the first question will go to the Buffalo News and Mark Summer. Mark, are you there? You have to hit *6 if you are on a phone, or unmute yourself on a computer. If not, we'll go to Steve Brown at Channel 2.
Thank you for the opportunity. I'm kind of curious why the reassessment is taking place on December 13th, given the recent spike. It seems like a long ways away.
Our Department of Health thinks we needed about 3 to 4 weeks, and we didn't want to push it to 4 weeks to take a look at the full effect of the mask mandate being implemented. So considering it was implemented on a Tuesday, 3 weeks after that would have been December 13th. And they felt that to really determine if the mask mandate was making an impact. What I've said on Monday and said again today is we will go to phase 2 if we have to sooner. But that's all going to be dependent on hospitalizations. And the hospitalizations really haven't changed much in the last couple of days. They've basically been at 90% capacity. If this time next week they're at 110% capacity, then yes, we might have to consider going to phase 2.
Is that the standard, 110% of capacity?
No, I know. It's just, it would be an example. We take into account the new cases and the hospitalizations. I don't want people to think that's the exact threshold. I'm also talking with the state about whether or not they're going to pull all elective surgeries from local hospitals, which if they do that, will, of course, create more beds. Chris Orvadas, Channel 4.
Mark, happy Thanksgiving. Can you tell me, I know it's been just a little more than 1 day, but based on the 30 or so hours that the mandate's been in effect, have you guys been seeing compliance? I know you mentioned that one anecdotal situation you were in, but on a more widespread scale, how is compliance?
Well, we had sanitarians go out yesterday. They were not issuing fines, they were issuing warnings. And what we heard is that in most places there appeared to be pretty good compliance. And also yesterday, email and other information went out from the Department of Health to those who get inspections and so forth to let them know that this was happening. So we have heard of pretty good compliance. Of course, we're worried about tonight and bars and what we might see in bars, which often, because this is the busiest bar night of the year, is one where you see bars absolutely packed. So we're worried about that. And we are concerned about other situations, but what we've heard is in most areas, we had very good compliance so far of staff wearing masks as well as patrons, though we did hear of situations where patrons were refusing to do it. And we'll address that on a case-by-case basis if we get to it.
Can you tell me how many warnings were issued yesterday? You said there were warnings issued?
I don't know how many off the top of my head. We'd have to get that from the Department of Health. Okay, we have Channel 7. Hannah Bueller.
Yes, hi, thanks for taking my question. In the local emergency order that was handed down this week, the last paragraph gives businesses an out of masking if they go to a full vaccine-only entry for customers, which you have already mentioned here today that some of the businesses locally have already done that. You just said here in the press conference that masks virtually stop COVID-19 in its tracks. So my question is, how does that work then by removing the mask if vaccinated people can still spread the virus? And a lot of people are asking, is the vaccine the end goal of this executive order?
We know from experience, including in downstate in New York City, where there is a vaccine mandate at all locations, that it has worked very well of keeping the spread down of COVID-19. We are aware that individuals who are vaccinated have a much lower rate of catching the virus or transmitting it than someone who's unvaccinated. We don't want to penalize locations that go to a vaccination only. We want to promote vaccinations, and so that's why a vax mandate is in place. That's why a vax mandate is in New York City, and it's another recommended by the governor. It's to promote vaccines. It's as simple as that. So we do know that in locations that have the vax mandate, for restaurants, bars, and other types of similar locations, theaters, that they are not seeing the rates of transmission that we are seeing when we have people not wearing masks and everybody open. So it just makes sense to promote vaccines and to let the businesses that take it upon their own accord to have the vaccine mandate in place to enforce it, but also to ensure that it's a safe environment. Now, if we hear of a business that says there's a vax mandate, but they're not checking on it, then we would basically at that point fine them. The businesses that are doing vaccine mandate are contacting our Department of Health, getting confirmation on how they're going about to check the vaccine. And if it appears like it's being done and it's done properly, that's good. We will be checking on those locations too to make certain that they're following through with what they said they would do. So if a location says they're gonna have a vaccine mandate, but then they have nobody at the door checking vaccine mandate, then they would be penalized as a result of that and have to go back to wearing masks. But we do know that vaccine mandates work because they work in New York City. And the governor is certainly promoting them across New York State, and we want to promote them as well. But we're not forcing it down the throats of restaurateurs and others at this point. They can do it if they so choose. Spectrum
I'm sorry, I
News.
could follow up.
You had two questions, and I think I answered them both. So Spectrum News now. Anybody on from Spectrum? Olivia Dance, Fox 29.
Yeah, thank you, County Executive. I have two questions for you as well. Going along with what you said about businesses implementing a vaccine mandate and therefore not needing masks, I'm curious if masks are still required in the Bills Stadium and KeyBank Center. And then my second question is, what is your response to the county legislator minority caucus to revoke your emergency powers? Thank you.
Masks are not required in locations that require a vaccine mandate. It's as simple as that. And that it would include both the football stadium and the hockey arena. That's the case. Now, first off, the legislature, and the second thing regarding the legislature minority's proposal to strip my powers, once again, they don't have the power to do that. I think they've admitted that. I would much rather see the legislators reaching out to say, what can we do to stop the spread than politicizing this. We had the worst day on record of new cases in Erie County. And on average, 85% of those who are testing positive have symptoms, which means they're sick. So I would much rather see legislators and others, instead of politicizing this, let us know what they feel they could do to help us to slow down the spread of COVID-19 and protect as many of our residents. This is not political. It's not a power grab. It's about protecting the public. And for those who think that I'm interested in doing this, they're crazy. I mean, I've had my life threatened in the past, and the last 36 hours has not been fun in some ways, but I also have had a lot of calls and emails from other people who are saying, you're doing the right thing, keep it going, Mark. So we're going to do what we think is right to protect our public's health and to keep our hospitals from being overrun. And if somebody wants to politicize it, they can, but that's not something I'm going to be looking at. WBFO? Okay. Anybody from WBFO? WBEN? How about Mark Summer
Hi,
from
Mark.
the...
Pocket.
Oh, go
Hi,
ahead.
County Executive. Can you hear me?
Yeah, go ahead, Mark.
Okay. So I know this is a trying situation for you. The last thing you really want to do is have to implement really, really tough mandates. But as you point out, the numbers have never been worse since the pandemic began. How are you going to make, what is going to go into your decision, and how soon might that decision be that you are going to have stricter mandates coming down the pike?
Well, we've got no time set saying here's the date other than December 13th. That's the day in which we would definitely revisit it. We're going to look at it every day, of course. But if we get to a situation that's very bad, that I'm going to talk over with business leaders and others in the community about whether they think it's appropriate to move into that next phase. The decision, as it pertains to the executive order and the phases will be made in concert with many other people. It's not going to be made just by me sitting at my desk. We're going to get the information from the Department of Health. We're going to get the information from our Department of Homeland Security and Emergency Services. We're going to get information from the hospitals. We're going to get information and feedback from the business leaders. So I don't want anybody to think there's any one particular day. We said we would revisit on December 13th, and we will. The primary driving factor is going to be hospitalizations. We cannot let our hospitals get overrun. It's as simple as that. If our hospitals get overrun, that means if someone has a heart attack, they could be waiting a few hours to basically get the service they need. If someone's got kidney stones, they don't want to be sitting waiting. They want to have service right away. Gallstones, broken arm, broken leg. We can't get in a situation where we're basically saying we're triaging people to the effect of your illness is not life-threatening to the point that we need to take care of you right now. We'll get to you in 12 hours. We can't be in that situation, and we're getting pretty close to it right now. So I don't want to put a particular date. I don't want to put a threshold. I want to talk to our partners in the hospitals, our partners in New York State, and the business community, and make a united decision if need be. We can avoid this if we just wear masks and keep the spread down. If everyone's wearing a mask and things are good, hopefully we'll see a reduction in cases starting in the next few days. If not, then especially with Thanksgiving, we could see a continuation for some time. And I just want people to understand it's in their hands. It really is in the public's hands. If we act appropriately, if you get vaccinated, and remember, 1 out of 4 Erie County adults has not even received 1 dose. To the other 25%, get vaccinated, wear a mask, regardless of your vaccination status when you're in public, and hopefully we'll get through this. Tom Puckett, WBEN. Did you leave, Tom? Still there, Tom? Just unmute yourself if you're talking.
And, record high level.
Okay. Is there anybody from any other media outlet that is on that was not called upon?
Mark, I'm here.
Okay, go, Tom. You were there, go.
Mark, I'm here.
Okay, go ahead, ask your question before we lose you again. You're not coming through.
All right, Mark, a question that we've been getting from our audience has been, I'm here, Mark.
Yeah, go ahead, just keep on talking, we're hearing you now.
The Erie County, Mark, your executive powers, you seem to be the only county executive in the region that still has these powers, and we've got listeners asking, why are you still using these powers when others have given them up and the state has given them up?
Well, I will state this, that we kept our emergency powers in place so that we could efficiently deliver vaccine clinics and testing clinics, and we were able to do that throughout the summer and the fall. The other counties, there actually is only one other county in Erie County that has a county executive. That is Chautauqua County. Other counties, I'm going to say this right now, and I know it's going to get them pretty angry. They're acting reckless by not implementing appropriate standards. Some of the percentages in these other counties are even worse than ours. And I truly think they're reckless. And they're talking, if they want to talk about freedom, they can have the freedom to die or let their constituents die, but I think it is reckless that they're not acting, whether it's Allegheny, Niagara, Genesee, Wyoming. They should be acting to protect their public. Our hospitals are getting their patients. Eventually, our hospitals are going to turn their patients away because there's going to be no room for their patients. And they need to think about that. So they need to act appropriately. I will always act in the best interest to protect our citizens and our community. If it costs me politically and people want to vote me out of office in the next election, so be it. I can keep my head held high knowing I did the right thing. For those who don't want to do it, I'm sorry. You're acting reckless and you're putting the lives of your constituents at risk, and there are people dying because of it. Simple as that. Any other media outlets?
County Executive, can you hear me?
Yes, go ahead.
Oh, okay, yeah, Ron Plants from Channel 2. As you're probably well aware, the small business community, members of it are considering a lawsuit against the mask mandate. We did just have a briefing with Corey Hogan, and he had brought up the point about contact tracing. Their contention being that they have not been able to get contact tracing information from the state or from the county, and their contention is that the last time it was available to the public was last fall, and it indicated household spread was worse than anything any business was doing. Are you willing to release the contact tracing information? And number two, very strong rumor out there circulating among some people that the number of hospital beds in this region is actually lower than it was at this time last year. Can you provide us with information on what the hospital bed availability is at this point to perhaps deter that rumor?
Well, I'll start with the second thing first. I will say this. It is staffed beds that the hospitals go by, and they are having problems staffing beds because of issues associated with just everyone's dealing with staffing. They've lost people that were working previously who've quit. So there are, as I said, staffed beds is the key. And remember, last year also there were elective surgeries that were banned. So there were more hospital beds available because elective surgeries were banned, as well as there was greater staffing because people just aren't working to the same degree they once were. I don't know the exact number compared to last year, but I do know as a staffed bed number, it varies on a daily basis, but there were more beds available because elective surgeries were prohibited and there was greater staffing in a lot of these institutions. We've lost, I believe, St. Joe's as a COVID, remember St. Joe's was a COVID-only hospital. It is no longer a COVID-only hospital, and Catholic Health is converting it, my understanding, to a nursing facility, so we've lost a lot of beds at St. Joe's. So I'm sure there's lots of rumors out there, but rumors aren't always true. And then in regards to the other one, if anybody wants to sue, we've said it before, we've dealt with lawsuits, we've won lawsuits. The contact tracing information that I've been told by our Department of Health epidemiological staff is showing transmission everywhere. It is in households. They've seen cases they believe are associated with restaurants. They've seen cases associated with bars. They've seen cases associated with other locations, workplaces, schools. It is impossible to say somebody caught it at a particular location. It is impossible to say that. I guess the closest you could do is a household, where if you had 5 members of the household and they all were sick, you would assume someone caught it outside of the household and then the rest of the household caught it in the home. But it is impossible to say this is the exact location. And unfortunately, that's what some of the people who criticize our actions are feeling, is that they're doing it because because they can't get definitive proof that someone got an illness in a location. It's impossible. I would note to those that are considering any type of lawsuit, New York City recently had a significant lawsuit against it for the vaccine mandate, and it was defeated. The lawsuit was defeated. The vaccine mandate survived judicial scrutiny by New York State Supreme Court judge and I believe appellate court. So if somebody's willing to bring a lawsuit, they're going to have to pay for it out of their own money, of course, but they should know that recent decisions in New York State indicate that these mandates are still valid. Vaccine mandate is valid, and we do it to protect the public.
So can you release the contact tracing information so this is out in the public and maybe take away that feeling?
Well, the ones who can release it would be the Department of Health. And that is often very confusing because people will say, well, where's the specifics associated with a restaurant or a bar? And we don't do that. We don't release the specifics associated with 1 or 2 locations. We've said the contact tracing indicates, and I want to remind you, Ron, there were 878 new cases yesterday, which means there's going to be 878 contact tracing reports in the next few days as they talk to these people. And that's on top of the hundreds and hundreds we've received in the last few days. So for those who are thinking like, oh, there's only this is easy, you can get it like that. It's not easy. Our contact tracers are working their tails off. And at this point, they're basically trying to get as much information they can from the public and then having those individuals contact their direct close contacts outside of their family who they think they were exposed to. It's bonkers. It's nutso and how busy it is. And if we get sued, we get sued. I've said it before, I'll say it again. It's part of our country. You have the right to sue someone, and you also have the right to lose a lawsuit in court. And if they want to go ahead and do it, they do it at their own peril by spending their own money to do it and potentially losing out. I will say this as an attorney who doesn't practice anymore, the only ones who win in that game are the attorneys who rack up a lot of legal fees, regardless of whether they win or lose. With that, we are almost near the hour. I want to thank Jen from Deaf Access Services. I want to thank you all for participating. I want to remind everybody we are in a terrible COVID-19 situation with new cases. The highest recorded case date ever was yesterday with 878 new cases, which means in the last week we had the highest date, the fourth highest, the fifth highest, and I think the eighth highest. So just in this week alone, we've had 4 or 5 of the worst days ever in the pandemic. And for those who are trying to make it seem like it's not real, it is real. There are people getting sick. There are people dying. There was a person under the age of 40 who died in 1 week during the past week, and it's all unnecessary. I do wish you a very happy Thanksgiving, but most importantly, have a safe Thanksgiving. Wear masks when you're out in public. Get tested to find out if you are COVID-19 positive. If you are sick, do not go anywhere. Do not subject yourself to other people because you could spread it on, and based on the Delta, you will spread it on. Western New York, unfortunately, appears to be a hotbed of COVID in the country right now, and we have to do better to protect our fellow citizens. So be safe and well to all, and have a happy